everybody. My name is Dr. Carla Alberts. I'm a naturopathic doctor at Revolutions Naturopathic. Today's meeting is to discuss one of my very favorite therapies called Broadband Light, and we're going to talk about everything that encompasses. So, what is Broadband Light, otherwise known as BBL for short? It is an innovative technology that helps to treat some of the most common signs of aging. So that would be dark sunspots, freckles, sun damage, even those small broken red blood vessels on the skin are signs of sun damage, fine lines and wrinkles. And then we also use the same technology to remove hair. It's commonly referred to as laser hair removal. The same technology can be used to treat acne, acne scarring, and rosacea. So there's a bit of a difference between broadband light and laser, and they're often used interchangeably, but there are some distinct differences between the two very different technologies. So broadband light, and I'm going to liken that to this picture here of the street lamp, which is very bright. It expands. You can see it casts a wide circle on the ground there, and so that's what broadband light is like. It's very bright and expansive, and it's a spectrum that contains hundreds of different colors and therefore has many targets in the skin that it can target and treat. Whereas a laser, if we look at the laser pen in the top, that is something that is not bright and expansive. It stays collimated from one end of the room. If you were to shine that from one end of the room onto the wall, it wouldn't expand out like a flashlight. It would stay the same distance and the same size. And lasers are used, they only contain one color, which means they only have one target, which is water, which make them a really good tool for ablation or removing skin. So lasers are used to remove skin for laser peels of light, moderate, or deep depths. They can remove moles and skin tags and things like that. So those are two major differences between those two technologies. And this is just a picture of the equipment that we have in our office here. So we have the Cyton Jewel, which has both the broadband light and the laser on there. And you can see the different wavelengths that come with that. And this patient is an example. She's getting a photofacial with broadband light therapy. So how does broadband light work? So it directs light energy into the skin that gets converted into heat once it reaches its target, which is also called a chromophore. And so a chromophore can be pigments. It can be broken red blood vessels. It can be post-inflammatory hyperpigmentation from acne and acne scarring. It can also be microbes that live on the skin to kill bacteria. So there's lots of different things that we can target. We can also target the hair follicle if we're going to use this treatment for hair reduction. And so once it destroys its chromophore, it creates some heat in the skin, and then the skin heals over, produces more collagen and elastin, and then eventually the skin gets returned to its healthy and natural condition. So a good practitioner who's well trained on this type of technology will know exactly what depth and strength and what settings to use on your skin type. So this is a list of the different conditions that we can use broadband light to treat. So again, we've got the more common signs and symptoms of sun damage. So pigmented lesions and freckles, age spots, vascular lesions, and small, they're called telangiectasias, but little broken red blood vessels in the skin. Acne is another big one. Skin integrity and firmness, because this does increase collagen and elastin production, uneven skin textures, and then of course hair removal as well. So I put a list of before and after photos in here just to show some examples of some of the common results that we can see with certain things. And so here's a nice before and after. I believe this patient received 2 treatments. So you can see this treatment was used to target her sun damage. And there's still a little bit of work left to do if we were going for gold, going for perfect. But not a bad result at all after only 2 treatments there. Here's another really good before and after picture, and this patient also received 1 or 2 treatments, and this was to target her sun damage. So you can see nice clear complexity. The nice thing about when we're treating sun damage and we're removing those inconsistencies and hues in the skin, if we remove those browns and remove those reds, the light can shine a lot more brightly off of one solid color versus something that has inconsistencies and hues in it, or kind of like a muddy color to it. So that's one of the reasons we get this nice youthful glow and a youthful appearance, is if we can remove all of that damage and make the skin one solid color. Then the light can reflect nice and shiny off of that. Here's another really good before and after photo. This patient received 1 treatment with broadband light to remove some of her sun damage. So you can see on the right there that most of her, of that hyperpigmentation has been removed from just that 1 treatment. Here's a good example of a patient who was treated for rosacea or, redness or broken red blood vessels of the skin. So this treatment, same technology was used to target the redness, the broken red blood vessels in the skin. So you can see he also received a nice result and has a nice glow to his skin. Here's a good before and after of a patient who had 2 treatments to remove sun damage from her neck and chest. And here's a nice example of removing sun damage from hands, before and after. And this picture is taken with technology that really helps to see the depth and extent of sun damage. And so this patient received only 1 treatment, and the top picture is her before, then the bottom one is after the 1 treatment. And you can see there's still quite a bit of work to do, and most patients are going to need a series to really clear all that sun damage, but you can even see how much improvement and how much damage was removed from her skin after just only 1 treatment. So that's great. And so there have been some studies and research done on the anti-aging effects of broadband light. And this is quoted from a research article from the Journal of Investigative Dermatology. And you can see the title off to the left. And the summary from this research article, so basically this study compared the changes in the DNA, so really down to the molecular structure of what changes are happening in the skin. And it was a lovely study, and essentially the results showed that the DNA in the treated patients started to behave more like younger skin cell DNA and resemble younger skin. So it's this is just a really good study I just wanted to share. And to that end, this is a nice before and after photo of somebody who's been doing them regularly. So a maintenance schedule once you clear all of your damage from your skin or you treat what you're wanting to treat. Maintenance treatments are just a couple times a year or every 3 to 6 months or so. And on the left, you see this gentleman was 43 years old. And then we have 12 years later, age 55, you can see there's a nice difference with the quality of his skin. There's fine lines and wrinkles are extremely reduced. He has a really nice youthful glow to the skin. Did have quite a bit of sun damage with hyperpigmentation and some rosacea that's been removed. So this is over just maintenance over time. So you can see how valuable this therapy is and how it helps to just make sure that your skin stays youthful as we age. As far as what areas of the body we can treat with this type of therapy, pretty much anywhere. The most common areas for sun exposure, of course, are going to be face, neck, and chest, hands, sometimes the shoulders and the back, but it can be used really anywhere. As far as how many treatments this requires, it depends on what we're treating. For example, if we're doing hair removal on a certain part of the body, some parts of the body will grow hair back faster than others, so that will make a difference. how much sun damage, if we're doing a sun damage treatment. If somebody has more sun damage or less, they might require more or less treatments. Darker skin types, because they hold on to heat more than lighter skin types, their treatment progression generally needs to proceed in a more gentle fashion. So it's not uncommon for them to need an additional 1 or 2 treatments in their corrective series, just because we need to make sure that we're a little bit more careful with darker skin types. As far as what happens during the procedures, so your eyes will be shielded with glasses, you'll be laying down, and what it feels like is a little, almost like a zip and a zing, like a warm, people often call it the rubber band snapping, and it's not uncomfortable. It's generally really well tolerated, and we do offer topical numbing cream for more sensitive areas. I would say a majority of patients don't use that, but it is something that we have on hand just in case that's something our patients want to use. As far as how long the procedure takes, again, it depends on the surface area, what it is that we're treating on the body, and what exactly we're doing. If there's a patient that has a lot of sun damage, we're likely going to be spending a bit more time cleaning up the area than somebody who has just a maintenance treatment. Again, is it uncomfortable? It's generally really well tolerated. It's not invasive and very safe. And there's, again, no need for a topical anesthetic in most cases, unless it's a sensitive area. As far as after the treatment, so I tell my patients that you can expect to feel as if you were in the sun for a little bit. Your skin might feel a little red and warm for a short period of time afterwards. If there's any sun damage or browns or reds, those are going to be more pronounced after the treatment, which is good, which is what we want to see. Those will start to resolve and subside and eventually flake off the skin in the 1 to 2 weeks after treatment. So that's a really good thing that we'll see, but those eventually do fade away because the treatment the treatment targets those chromophores and destroys them. How long does it take to recover? There's no downtime for this procedure. So you can resume your regular skincare regime. You can wear makeup. You can go out right away. You can go to the gym right away. So there really is, most of the time, no recovery time for this. As far as aftercare, again, the same thing applies. There's not really many changes for most patients that they'll need to do afterwards. We might make some adjustments temporarily to their skincare regime based on what they're using. But really the most important thing for these treatments is sun protection. It does make your skin a little more sensitive to the sun. So you'll want to be sure that bookending each procedure the weeks before and weeks after, you really want to make sure that you are avoiding direct sunlight. Doesn't mean that you need to be a vampire and stay in your home. It just means that if you're going to be out in the sun on a walk, or on a hike for an extended period of time, that you definitely want your sunscreen, which you always want rain or shine. And then some patients will shield the treated area with a wide brim hat if they're going to be outside for an extended period of time. And that is pretty much where my presentation sums up for broadband light therapy. If this is something that you feel might be beneficial for you for any of the reasons that we talked about, you are welcome to reach out to our office. We do offer aesthetic consultations that are about 45-minute appointments. The cost for that appointment is $99, but it does get applied towards your very first treatment. So in that appointment, we go through how your skin responds to the sun, addressing what concerns you have, going over your expectations for treatment, and that type of thing.